Thank you for joining me for an overview of how to help prevent youth suicide. You'll learn the ASK acronym to help you respond effectively and appropriately when a student is at risk for self-harm. Suicide is often preventable, and school personnel are in a unique position to help. We are natural gatekeepers in this process. In this brief video, we'll answer the essential question, what do I do if I think a student is suicidal? We'll learn the basic facts and intervention skills that'll give you the confidence to respond to youth in crisis. Suicide is the second leading cause of death for persons between 15 and 34 years of age. It's the third leading cause of death for youth between the ages of 10 and 14. Suicide attempts by males are more often lethal. More females attempt suicide, but more males die. Latina females have the highest attempt rate, and white males have the highest death rate. Data from a 2011 Texas survey indicates that 1 in 10 students report actually attempting suicide. That's almost 3 students in every one of your classes. A mental health or substance abuse issue is an underlying condition for 90% of those who die by suicide, even if this condition is not diagnosed prior to the suicide. Stress, the loss of a loved one or a relationship breakup, and access to lethal means are also contributing risk factors. Protective factors are all about relationships and connections. Ongoing research shows that the most lethal combination is a feeling of being alone, a feeling of being a burden, and a lack of the fear of dying. One person wrote a suicide note that read, "I'm walking to the bridge to jump off. If one person smiles at me on the way, I will not jump." This person died by suicide. As educators, we may see or hear about deteriorating grades or a lack of enjoyment of activities that the student previously enjoyed. Students may show mood swings and may talk or write about death. They may be in an unhealthy or an abusive relationship and may actively seek access to pills, guns, or other lethal means. Granted, we don't always know all the circumstances surrounding a child, but we should trust our instincts and act. If you're talking to a student and you wonder if that child is thinking of suicide, you may assume that thoughts of suicide have crossed the mind of that young person. Some youth have a pre-existing vulnerability, especially lesbian, gay, bisexual, transgender, or questioning youth. So what do we do? Take action. Just remember the ASK acronym. A equals ask the direct question. This is the hard part, but this is the part that needs to be done. Ask directly. Have you thought about suicide? Are you having thoughts about killing yourself? Are you thinking of ending your life? Contrary to what you may have heard, asking these questions will not put thoughts of suicide into a person's head. Instead, most students will be relieved and amazed that someone cares. S in the ASK acronym stands for safeguard the student. Do not leave them alone or send them anywhere alone, not even to the bathroom. K equals know how to refer, know how to reach out for further help. On a school campus, contact the school counselor immediately or call the LSSP or the assistant principal. If you're the sole adult responsible for the child at the time, call 911. There are specially trained members of law enforcement who will respond. Immediately contact the child's parent as well. Let's go back to that essential question. What do we do if we think a student is suicidal? And the answer is ask. A equals ask the difficult question directly. S equals safeguard the person. And K equals know how to refer. To help you remember and to keep all this literally at your fingertips, there is an app that you can download. Go to the App Store on your phone, search Suicide Prevention, and download the ASK app. Thank you for your attention and participation. We can all help prevent suicide.